This video is for basic facial, and it starts as if I have just arrived to work. The first thing that I do when I get to work always is wash my hands. So I would wet my hands at the sink. I would find that coin-sized amount of liquid hand soap, wash my hands together down to the wrist, wash the back of my hands down to the wrist, wash my fingers together, wash the backs of my fingers. I'm gonna wash my fingertips and nails. I'm gonna wash between my fingers. Gonna wash between my fingers and my thumbs, gonna wash my thumbs, gonna wash my wrists. And I'm gonna do all of that interlocking cleansing for a minimum of 20 to 30 seconds. And then when I've gotten that good cleanse, I'm gonna thoroughly rinse and wash my hands underneath the sink. When I feel like I've gotten that thoroughly rinsed, properly rinsed, I'm gonna grab some disposable paper towels or a clean towel, turn the water off with a towel, dry my hands completely. Paper towels, if I use them, would go in the trash, and then a towel would go into a closed container until it's time to do the laundry. And then, of course, we would be grabbing our hand sanitizer, 70% ethyl alcohol, and we would sanitize our hands to finish that official hand wash. And then the next thing that we would need to do would be to prepare our workspace and station for our basic facial. So what we want to review are the steps to go through to do that. So we would disinfect our workstation, bed, and equipment using a disinfectant wipe following the manufacturer's instructions. We would, of course, check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. We would gather clean supplies needed for the facial service, storing in a clean, closed container. We would turn on the hot cabbie and stock it with at least 3 clean, wet towels. More may be needed depending on the service and the client's needs. We would fill a clean steamer glass with distilled water, and we would go ahead and preheat that steamer. We would dispense products needed for the service according to skin type and client's needs as follows. We would prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray. Or we could remove the product with a disinfected or clean single-use spatula, close the lid to the product, and set the portion cup tray on the tray. Then we would drape our facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Place clean laundered sheets down on a disinfected facial bed, placing a towel horizontally at the head of the bed, laying a hairnet and headband on top of the first towel along with a rolled towel to support the head and neck of the client. Save the 3rd towel to lay across the client's décolleté. And of course, you would do all of that before the client arrives, and maybe not knowing everything about the client, you could potentially prepare as much as you can, and then maybe even have those options out, and then you would know the last few things that you could do before the client arrived, or when the client arrives, that you would need to, that you would not be able to do ahead of time. So that being said, I have set up my tray for my mannequin facial, but I want you just to review what I have on the tray. So of course I have water, and I have astringent here later for extractions. I've got makeup remover, cleanser, toner, exfoliating product. I've got massage, and I have my mask. I have a fan brush for the mask. I have gloves and wooden stick Q-tips for extractions, cotton rounds, 2 squares and 4 squares. Of course, I have my bed made, everything laid out. I've gotten a towel for me. The only thing I'm going to do right now is prepare my hot towel post exfoliation. I don't have a cabbie, so I'm going to do it just the old-fashioned way. And we're going to pretend like this is going to be a hot towel. So all of this would be done, of course, before my client arrives. And I'm just trying to get it nice and hot. And obviously it would be in the cabbie, so we wouldn't be worried about that. So now we would just be be moving forward in our processes as if everything is ready, the bed's made, etc. And we would be doing our client consultations. So we are going to greet our client. And of course, when I go and greet the client, I would always be greeting the client with clean hands. So just keeping that in mind as if they were perfectly washed. I will be washing my hands again before I start the service. So just so you know, I am approaching my client right now with completely clean hands. So we would greet our client and escort them to the work area. We would determine the client's preferences and assess the client's needs. We would assess the client's skin by performing a skin analysis, at least with our eyes, because that's all you can see right now is just that visual check. You're not doing any more detail than that, to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. We're going to assess the client's consultation form for any medications and products used within the last 72 hours, and you're going to consult on any known allergies. All of this takes time, and it's super important. Obviously, you wouldn't want to use any products that have something that your client may be allergic to in them, etc. There's so much to go over. You want to consult with the client on any facial surgeries within the last 3 months, and if the client's under physician's care, you'll assess if the client is prone to cold sores or fever blisters. You'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids or beta hydroxy acids, hydroquinone, etc. You'll assess if the client has had any facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free from any of those contraindications, you can move forward with the procedure or service. Thankfully, our girl is, so you just have to keep in mind that you really need to really dive into what that says and take the time to communicate to make sure you're not putting your client at risk. You're her skincare professional, and you need to make sure that you're doing everything you can to give her the best service and then also keeping her safe. And if it's not the right time, then you have to be able to tell her that you'll book her for another appointment. So we're going to get her comfortable in the bed before we wash our hands again and get started. So what we want to do is give her some privacy, because she will be changing for this procedure. She'd be putting on a drape. So that's laid out for her. So you would allow the client to put on the drape and then lie down in the facial bed, and then you could help them become comfortable. So what we're going to do here is we've got our rolled towel that we're going to place under their neck for extra support. We have the headband or hairnet that we're going to cover up the client's hair to keep out of the face. And then we've got an extra towel that we are going to utilize to cover up the décolleté. So she's nice and cozy and covered and comfortable, and we're just checking in with that. And then we will now be able to move forward with the service. So I'm going to wash my hands. I'm going to go to the sink. I'm going to wet my hands. I'm going to find that coin-sized amount of liquid hand soap, and I'm going to wash them thoroughly down to the wrist. I'm going to wash the back of my hands down to the wrist. I'm going to wash my fingers. I'm going to wash the backs of my fingers. I'm going to wash between my fingers, and I'm going to wash between my fingers and my thumbs. I'm going to wash fingertips and nails. I'm going to wash thumbs. And I'm going to wash wrists. And I'm going to do all of that beautiful interlocking wash for a minimum of 20 to 30 seconds. And when I feel like everything is clean, I'm going to thoroughly and properly rinse them underneath that running water. When I feel like everything has been rinsed off, I'm going to get some disposable paper towels or a towel, turn the faucet off, dry my hands off completely. If it's paper towels, they can go in the trash. If it's a now dirty towel, it can go in a closed container until time to do the laundry. And then we're going to grab our 70% ethyl alcohol hand sanitizer, sanitize our hands. And then it'll be time to get started on our facial. So the first thing that we're going to do is, if our client has on any makeup, we're going to remove it. So taking a minute here for our makeup remover. And we will remove. Some clients have on more, and some have on less. So just do what you need to do to get that off. And then once the makeup's off, we're going to go ahead and do our initial cleanse for our client. Just want to make sure that you're getting off any dirt, makeup, etc., any kind of like residue or whatever that you need to get off. And then you will go ahead and remove that first bit of cleanser. And then we are going to cover the client's eyes up because we're now going to be evaluating the skin underneath the magnifying lamp or the Woods lamp, and you need to protect their eyes. So we're going to cover it up with cotton rounds. We're also going to give it a little extra cover so it's really not going to harm them. And then we don't have a magnifying lamp, so we would be bringing that in and we would be looking through that lamp to do a really proper skin analysis. And what we're looking for, there's a lot of things. When we did that initial consultation, we were just talking to our client, we could only see so much. But now with the magnifying lamp or the Woods lamp, there's lots more detail to tell us more information about the skin that we need to know. So the client may have put specific things on the form that she's really looking to address, and she may have also discussed that with you. So there's lots and lots to discuss. You could be looking for fine lines, dehydration, excess sebum, or a lot of breakout. Like I said, dehydration. You're really trying to figure out and learn your client's skin and to see what's happening with the skin, because you need to be able to not only address it in this treatment and make it better, but you're going to want to support what she does at home with product recommendations. You're also going to be able to recommend services that would be helpful to her skin so that she really achieves those skin goals and gets the maximum results that she wants. But there's lots and lots of things that you could be taking the time to evaluate. You also once your client leaves, we'll be making notes either in your software system or on your client profile card about specific things to that client's skin. That way, if there's any changes in anything like freckling, moles, etc., you're going to be able to get her to the right person or address him or her to the right person if something changes and you think that it needs further attention. So you might be looking for congestion in the skin. You might be looking for open skin, like anything that you could possibly see that you could support or help with. And so then once you've done that really good skin analysis, you'll turn your light off and you're going to take it out of the way. You'll be able to remove all of these things, and then you can go in for cleanse number 2. And you may be able to stop after cleanse number 2. It really depends on the client and how much they have going on with what they need to clean. So we're going to go through our cleanse number 2 and really make sure that they're nice and clean. Any little bit of extra. To really prepare the skin for the next steps. And then we'll go ahead and remove that cleanse number 2. And then we will dry this one off. And then we're going to do a third and final cleanse. So if there's anything on there, now is the time definitely to make sure you get it off. And then I'm going to remove this third and final cleanse. And then after we finish removing this cleanser, we are going to tone. And you can either use something that you wet, or I actually have a spray, but I'm not gonna let that spray come into contact with my cotton rounds, or 2x2s rather. So I'm gonna be spraying it, but I'm gonna be holding it at a distance, so it never has a touch with it. And then after you finished your toner step, you're going to move forward with exfoliation. So depending on the kind of exfoliation that you're going to do, you're going to follow manufacturer's directions, but there's a whole lot of different things that happen. So I'm going to take a little bit of exfoliant, and I am going to spread it out first around the face, like a pea-size amount, because I'm going to be massaging it, and put a little bit on the neck too, massaging it in for like about 1 to 2 minutes. And this is a physical, not a chemical, so I do want to massage it in, but even some of the other ones you want to massage into. So this is just you got to follow those manufacturer's directions on what you're doing. You don't need a lot. You're always going to avoid the eyes, the nose, and the mouth, always, with anything you're doing here. We're exfoliating. And when you feel like you've done your massage for 1 to 2 minutes, we're going to talk about what we would be doing the next part of the exfoliation. So just reviewing that, we're going to go over all those details right now. So at this point, after you've followed your instructions of the manufacturer and you've massaged that exfoliant in, you would be finding that facial steamer that you set up and preheated before the facial started. So you'd be bringing that, retrieving that steamer and bringing it over by the bed and turning it to the on position. You would just make sure it's facing away from the client. As the water heats up and emits an even outflow of a mist. Once the steamer is emitting a mist, you can position the steamer 16 inches over the client's face and aimed at the client's chin for even distribution on the face, allowing the unit to function for 3 to 5 minutes. Steaming. So we've brought it over, we've turned it on, and we've positioned it toward the face, aiming it at the chin. We're letting it do that even mist across the face for 3 to 5 minutes. But because we're doing a video, we don't have a steamer. We're not really going to sit here for 3 to 5 minutes. So we're going to pretend like that 3 to 5 minutes has already elapsed. And what we would do is we would then turn the steamer away from the client's face, and then you can turn it off, take it, return it to where you originally got it from until later on for disinfection. So we're going to get it back in that previous location. And then we're going to remove our exfoliant. And we don't have that cabbie, that hot cabbie, so we're going to retrieve our steam towel, our hot steam towel from the cabbie. And we're just going to assume that it's coming from the cabbie and it's hot. So we're going to obviously shake it out because it's hot, let it cool down a little bit, and then we're going to check the temperature on our wrists. And then we're also going to check in with our client on the collarbone to make sure that it's okay temperature-wise, which it is for her. And then we're going to do just a nice little fold over the face here, keeping the nose out and letting that nice steam towel on the face here for a minute. Not really a minute, but we're going to just let that rest there 20 to 30 seconds before it starts to cool down, because it will start to cool down. And then we'll be able to remove the exfoliating product. And then once you have finished removing that product, you can dry your hands off, because you are going to get ready to move into the extraction portion of the facial if that's needed. And you're doing that, and there's a couple ways to do it. So we're going to dry our hands off, and normally my client doesn't really deal with much as far as congestion in the skin or like needing any extractions, but with everybody wearing the masks all the time these days, she's dealing with a little bit. So we're going to address that. We're going to go ahead and take care of it. And we are going to probably bring the magnifying lamp back in again. So I'm going to go ahead and recover those eyes so that's not uncomfortable for her. And we've got a couple of options here. We can take, which is what I'm going to do, wooden stick Q-tips soaked in astringent to remove one extraction at a time, and you would toss them and get 2 new ones every time. You could also use cotton rounds soaked in astringent over the finger, and then kind of do that light pressure and then work your way around the cotton rounds and then throw them away. Excuse me, I need to get a sip of water. Getting choked up. All good, no coughing, just a little choked up, sorry. So what I'm going to do is get my cotton rounds, soak them in the astringent, pretend my magnifying lamp is on top and I'm looking through, and I'm just going to perform. She only has a couple little bit on her chin here. And then we would be tossing these, obviously getting a new set. last one. It's really all just in that chin area. And that's it. So after you've done that, you can turn the magnifying lamp off, take it out of the way. We're going to go ahead and remove our cotton rounds and our Foursquare again. And you can remove your gloves. And before you move forward, we're going to go ahead and tone. So we've done that exfoliation, extraction, and now we're going to use our toner again, just to refresh that skin where we were certainly a little tougher on it. And with exfoliation, you do not want, extraction, you do not want to leave that on any more than 5 to 7 minutes. You don't want to perform that any more than 5 to 7 minutes, as it can get quite uncomfortable sometimes. So extractions, just be mindful of the timing with your client, as it can be painful. We don't want them to, part of the point of the facial is the relaxation, and you don't want them to get to a point where they just can't take it anymore. So we're going to be tossing those gloves, and then we're going to tone. So once again, with my little 2x2s here, I'm going to spray some toner on them, keeping that away, of course, from the actual container, so it doesn't ever come into contact. And then after your toner is done, you get to go into the part that your client probably will enjoy more than anything, and it's the massage portion of your facial. Only things to note about that are that you want to make sure you get the right amount of massage product as you're removing it, because you don't want to have to go back into the client and get more. So make sure that, leave the client to go get more massage product. You want to be able to keep your hands in contact with your client the whole time during the massage portion. So just be mindful of that while you work, that you would want to be able to continue your massage throughout until you're done. So I'm just taking the time to make sure that I spread it out over the areas that I will be massaging, so that I don't have to go back in to get more product. And then I'll be able to start my massage, and then I'm going to be kind of quieter for this section so that I can let my client, I would be quiet through the facial, but this is really where you want to just focus in on what you're doing, and what you're trying to do is different techniques for different muscles on the face for different reasons. The only time that you would not be doing the this full massage is if someone has really bad, challenging cystic acne. They do not need a lot of massage and stimulation, so just be mindful of that. And of course, you would have already figured all of those things out and figured out what you were going to do in lieu of that. And then when you're finished with that massage, you've got to remove the massage product, of course. And after you do that, it would be time to apply your mask during the facial. And I'm going to use a brush to do that. Just like everything else, we're going to avoid the eyes, the nose, the mouth. And you would, of course, follow manufacturer's directions for mask application. So following those directions, and then you would leave it on based on goals and manufacturer's directions. We're going to say anywhere from 5 to 10 minutes. Because this is a video, we're not going to sit here for 5 to 10 minutes. So we're going to pretend like that time has elapsed, and we're going to go ahead and remove the mask product. And once you complete this step, you're going to tone one final time. Once again, I'll be Staying away from my container. And then to finish up, we're going to be applying a little bit of eye cream. So you're going to take a teeny bit of eye cream with your ring finger, because it's the most delicate fingers that you have. And you're going to, you don't need it much at all. You're going to take a teeny little bit. And you're going to tap it around the brow bone and the zygomatic arch. And then you're going to apply moisturizer. And my client needs Prevention SPF 15. She needs a sunscreen and a moisturizer with some hydration. So, excuse me, SPF 30. We did talk about the importance of SPF, and I will be reiterating that as we close out here in a minute. So I'm going to apply the SPF moisturizer everywhere. I'm going to, of course, apply it to the face. I'm going to apply it to the neck, a little bit of décolleté, maybe ears, anywhere that might be exposed. And then we'll be finishing her massage up. Massage, her facial. Seems like a massage, doesn't it? This takes a long time and it's relaxing. And we give her a minute, and we tell her that we will meet her in the waiting area. A nice little touch also would be to finish with maybe a lip hydrator. We're going to take off this, and she will have a chance to have some privacy to get dressed and meet us out in the client waiting area so that we can go over any maintenance and aftercare that she might require. Of course, we are going to review her at-home care skincare recommendations, certainly based on what we've done today, what her goals are. But we're going to make sure that she goes home with that aftercare, and that any specifics that she was really concerned about, and we're going to get her booked in for her next appointment, no question. As we have a plan now that we've done this, and we can really have a conversation about what we saw and what needs to happen to achieve her skin goals. So we've taken care of that, we've got her checked out, and then we need to get ready for our next client, which is also a facial. So we're going to come back in immediately. We're going to toss any single-use items and grab any implements and put them in a closed container labeled to be disinfected. We're going to strip that bed of all the towels, the sheets, anything that we've used, put it in a closed container until it's time for laundry. And then we are going to identify and find a proper cleansing agent. We're going to read and follow manufacturer's instructions for mixing and usage. And then we're going to wipe down our workstation area with the cleaning solution to remove any debris. We will identify a disinfectant that is bactericidal, virucidal, fungicidal, EPA approved for use in a salon setting, which means we need to put some gloves back on, because you're always going to be using gloves when you're using that kind of a product. You will follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant, and you will disinfect electrical equipment, for example, our facial steamer. Store it in a clean area separate from other implements. And then you can throw those gloves away, because you are going to finish by washing your hands. So you're going to get to the sink, wet your hands, get that liquid-sized amount, liquid soap, coin-sized amount, and you're going to place it on your hands. Wet hands, wash your hands down to your wrist. You're going to wash the back of your hands down to your wrist. You're going to wash your fingers, and you're going to wash the backs of your fingers. You're going to wash your fingertips and nails, and you're going to wash between your fingers. You're going to wash between your fingers and your thumbs. You're going to wash your thumbs, and you're going to wash your wrist. You're going to do all of that interlocking wash for a minimum of 20 to 30 seconds. When you feel like you've gotten everything thoroughly clean, you can give it a good proper rinse underneath the sink. When you feel like that everything's rinsed off, you're going to grab either disposable paper towels or clean towel, turn the faucet off with the towels, dry everything off thoroughly. If it's paper towels, it's going in the trash. If it's now a dirty towel, put it in that other closed container with the other dirty linen until you do laundry. Then finish it up with your hand sanitizer. You've got to find 70% ethyl alcohol, and you can go ahead and use that hand sanitizer to thoroughly wash, just as you did with your other liquid hand soap, and finish it out properly. And then you are ready to set up and move forward to your next prep for your next client coming in for the basic facial. So that concludes a basic facial video.